This is Taylor Swift.
Okay, how's
You know what
that?
I mean by Taylor
No.
Swift? It was a great move, right? So every once in a while, well, probably every 10 minutes, someone DMs Taylor Swift and says, "Can you come sing at my Sweet 16?"
Let's talk about another boots on the ground tactical application, attending patient follow-up appointments. Have you heard me talk about this?
No, what do you mean?
Okay.
Attend patient follow-up appointments. What do you mean by that?
This one, obviously, you need a patient. So it's not a 0 to 1. It's like a 1 to 10 kind of scenario. But once you have a patient, that patient is likely going to a physician follow-up. The
Oh,
patient is typically referred to therapy. Then I talk to the patient on the eval. When are you going back to see the doc? It could be a surgical follow-up. It could just be just a general condition. When the patient is going back to the doctor, I say, hey, you know what? I've got some extra time on the schedule. You've got a bunch of questions about this condition. You want to know XYZ. I'm going to meet you at the doctor's office. What time's your appointment? It's 10 a.m. on Thursday. Okay, I'm going to block my schedule. I will meet you there. I'll be in the lobby at 9:45. If for some reason I am not there, just go in without me. I must have got called out to emergency, but I will plan on being there 9:45. I'll see you in the office. And I do. And I go and I show up and I sit there and the patient goes and checks in and then comes and sits with me and we talk and we review the questions that they want to ask that they're not sure about. The medical assistant comes out, Mrs. Patient, come on back. And she comes, and this is exactly the way it goes. I come with the patient. The medical assistant does the weight, does the blood pressure. They're looking at me, they're looking at the patient. Every single time the
who
patient's
is
like,
this?
check it out. This is my physical therapist. This is Tony. I'm like, hi, nice to meet you. And I just sit there and I'm quiet. And so we go in and then the doc comes in. I don't say a word. The patient's like, this is my physical therapist. And I'm like, hi, nice to meet you. And usually at some point, about 15 to 20 seconds in, the doc said, how are things going? The patient looks at me because they don't know what to say. And I'm like, she's doing amazing. We did this, this, and this. She's improved this. She's still having difficulty with this. Her main concern was she wanted to know when she could do this. And in 30 seconds, I conveyed to that doctor what would have taken my patient 10 minutes, which we know how valuable those 10 minutes are. The
Yep.
doc appreciates it. The patient loves it. And I can then sit there and listen to them talk because the doc is saying stuff the patient doesn't understand, and the patient's trying to say stuff the doc doesn't understand. Inevitably, when we finish, we leave. It's always 20 years of history. It's always been a positive experience. I've never had a single negative experience. Um, and afterwards, the patient can't believe I blocked 3 hours of my schedule. Of course, you guys don't have a ton of patients, so you can do it. The doc can't believe. In fact, we're in a city where ATI is one of our chief competitors. They heard that I was doing it and they started forcing their therapist to do it
Had
because they
to.
knew I was doing it.
Had to.
Um, but anyway, you could do it virtually. If you can't be there in person, you tell the patient, hey, I want you to initiate the FaceTime when the doctor is getting ready to come in. And the same thing, you're not marketing, you're not selling. Back to Gary V, you're jab, jab, jab. Don't even try to tell them anything. But usually what happens 2, 3 sessions in, different patients and different interactions, then I'm like, hey, doc, can I just talk to you in the lobby for a second? We step out. I'm like, hey, I've got this patient. I think it's a perfect referral for you. It's not a Medicaid insurance. It's a commercial plan. They have this problem. I think you're the perfect solution for it. Can I send that patient to you? I don't even ask for a referral before I send a couple patients to that surgeon or whoever the doctor is.
Yeah.
Every single time it is led to a solid relationship.
This is Taylor Swift.
Okay. How's
You know what I
that?
mean by Taylor
No.
Swift? It was a great move, right? So every once in a while, well, probably every 10 minutes, someone DMs Taylor Swift and says, "Can you come sing at my Sweet 16? Can you come sing at my wedding? I'm getting married in the town that you're performing in or whatever." And a million times out of a million, Taylor Swift doesn't respond, or whoever's actually reading Taylor Swift's DMs, right? It's not Taylor, probably. But every once in a while, you see a video of Taylor Swift showing up at a backyard wedding and people going bananas, right? Myself included, right? And I'm not even a Swiftie. And you understand what that like return on investment, because in that room, right, when you're saying in the first 15 seconds, like the doc or the medical assistant is like, who is this? Is this a, husband related, whatever? And you're showing, not telling, you're showing, going back to like touching an emotion, You're not saying I'm the best physical therapist. You're literally just by being there saying, I'm here and I care without saying a word, right? So you're showing the patient and they feel like, I don't know, I feel like a wide receiver. My PT showed up to my appointment. And the doc is like, because no one does this, because it's insane. Taylor Swift can't show up to every appointment. You can't do this every single time, but you're doing it. No one's doing it. By you doing it 1%, 1/1000th of the percent of the time, that doc is like, wow, okay. Because the problem that you solve for the patient is everything we discussed in the beginning of this video, right? This is a little extra that they're not paying for, but they're getting. The doc is saying they care. If I send them patients, he's just gonna. I bet you, if he does this, what do you think he's doing in his clinic when he is getting paid? That is show, not tell. Show and tell is an important day in third grade. Everybody loves it. The show beats tell. So to me, I mean, if you have time and you're sitting there saying, "Man, I wish people would show up," maybe you should show up somewhere first because that's how seeds work. You plant them, then you wait and wait and wait, and then they come and you can harvest.
So here's a perfect scenario that I think everybody should consider. The typical way it's done is the therapist brings donuts for the office, goes
Sure.
in, sits there and waits and asks for 5 minutes of the doctor's time. The doctor isn't paid for those 5 minutes and they lost that 5 minutes of production that they could have been doing something else. Conversely, I go in with a patient. The doctor is getting paid for that time. And I'm actually delivering value because I'm helping to relay information in a succinct manner that the patient could never relay. And the
Yeah.
doc's not going to read my report. So that's not even an option.
Right. Right.
So, there it is the same effective experience. I'm face to face with the referral source, but in completely different context. And like I said, therapists for 20 years have been so scared to do it. Everyone who has done it, everyone has had a positive experience.